Training people in health systems to work in suicide prevention and to work with people who are suicidal is important for a few reasons. The first is that we know now from some good evidence that the first point of contact for people who are at risk of suicide is critical. If they get an effective and empathic response at that first point of contact, it increases the likelihood that they will engage with treatment and therefore have a better recovery. So it really reduces the risk for people. And secondly, the other reason that it's important is that often when health professionals go through the training, me included, we often don't get much formal training in working with people who are at risk of suicide. And that can be a really uncomfortable space for people to work in. And often when we talk to health professionals, they will tell us that they're unsure how to proceed.
I think training in this space of suicidality is really important. Obviously, with my experience through attempting to take my own life, speaking from a place of lived experience, I know that I've been able to help a lot of clinicians understand what it means to go through these things. And I think implementing that into training is going to be really important to create the change that we're looking for in this space.
So part of training people is to make sure that people are skilled and do have the knowledge to work effectively with people who are at risk of suicide. The other reason that we need to train people from all across health systems is that we're never sure who's going to be the recipient of information that someone might be at risk. So people who are at risk of suicide, like most of us, may have a range of other health problems. So they could have chronic pain, there could be cardiovascular disease, there could be a range of other illnesses that they have. So it's not always just mental health staff who are in a position to be able to identify, to recognise that someone might be at risk and to be able to respond to that effectively. People who die by suicide are often in contact with a health professional in the months or weeks preceding their death by suicide. We know that within the past month, for people who've died by suicide, that about 45% of them have been in contact with their primary care physician, and that if we look back over the previous 12 months, that figure rises to about 3/4 of people who die by suicide. And there is another study which shows that about 10% of people who die by suicide have been to the emergency department within about the previous month. Often people are presenting to their general practitioner or to another health professional for another reason, but if we start to ask about how they're going with their mental health or thinking about suicide, we uncover a whole bunch of other problems that they might be dealing with. In selecting training programs for staff, if people are wanting to provide skills and knowledge around suicide prevention, it's important to start with understanding what it is that staff already know, so what skills do they have, what attitudes might people have to suicide, and to use that as a platform for then selecting the right kind of program. Selecting training that aligns with the Zero Suicide Framework is important because we know that if we deliver training on its own, people will learn some skills and knowledge, but if that's not supported by systems change, culture change and leadership, then it makes it difficult for people to use the skills and knowledge that they've learned. So having that integrated approach from training through to leadership through to systems and culture change is going to be more effective than just delivering training on its own. The training also needs to be specific in its provision of skills and knowledge around suicide prevention. So we know that treating risk factors like depression or other mental illnesses is important, but also addressing suicidality directly is really important as well. So whatever training is provided needs to be specific to suicide prevention. A good training program will also use adult learning principles, and that might mean using a mix of learning methods, and it might also mean that there needs to be refresher training provided as well. The whole organisation needs to be trained because, as I said before, we can never really be sure who's going to be the recipient of information that someone is at risk of suicide. A just and restorative culture is important in the Zero Suicide Framework because it's about having a learning culture within the health system. And what a just culture does and a learning culture does is to ensure that when a suicide occurs, the investigation focuses on what happened, how it happened, and importantly, how suicides can be prevented in future. This is contrary to what happens in many health systems now, where the focus is on retribution and blame. If we don't move to a learning culture, so move away from trying to find someone to blame, then it inhibits the deep learning that is necessary in order to prevent complex and difficult problems like suicide.